If you'll please state your name and who you represent.
Hi, yes. My name is Tania Cordobes, and I'm a music therapist, and I work at the Children's Advocacy Center of Collin County.
You may begin.
Thank you. I'm a music therapist. Since April of 2001, I have worked at the Children's Advocacy Center of Collin County, treating victims of child abuse and their non-offending family members. The American Music Therapy Association defines music therapy as the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. The use of music therapy in a trauma-focused healing environment is very different from an environment of leisurely listening to music. Sounds, music, tones and voices, images, even the time of day can be triggers for the victim. Understanding the way music works in the brain recovering from trauma, I design interventions such as music listening, songwriting, lyric analysis, music intervention, and music and movement in individual, family, or parent conjoint sessions. I see a decrease in symptoms of emotional dysregulation, poor coping skills, anxiety, social isolation, and poor performance in school. The child obtains increased resources for coping with triggers, communicating thoughts and feelings, and processing the changes in their lives. The increased ability to communicate thoughts and feelings is one of the most important tools a child or teenager can possess to decrease the chances of future victimization. If they do not tell or they cannot communicate what they are feeling to a safe adult, we cannot provide safety, healing, or justice. I have had the privilege of providing music therapy interventions for hundreds of clients recovering from child abuse and neglect. I have seen firsthand how a child who demonstrates symptoms of abuse can develop an emotional vocabulary, return to their family and classrooms, and even go to court to say what happened to them with the ability to regulate their emotional states and express themselves in a calm, insightful, and confident manner. House Bill 1376, introduced by Representative Sarah Davis last session, would have established an advisory council to study the need for state recognition of music therapists in Texas. The music therapists in Texas believe that state recognition could protect and benefit consumers by ensuring a minimal level of competency, which is incredibly important for these extremely vulnerable children. Mr. Chairman, I would like to provide the committee members with written testimony from several of my music therapy colleagues throughout the state who were unable to attend today's hearing. Thank you for your service to this state, and we look forward to working with you next session on legislation to study state recognition of music therapy in Texas.
Thank you. Would you give us a, just for our benefit, kind of a, maybe, I don't know that there is such thing as a typical example, but an example of maybe how you would use music therapy to engage with a child in that setting?
Yeah, there's lots of different ways through songwriting. One of the really interesting and effective things is to create a short song to help the child remember their coping skills. And if you can think about learning the ABCs, every child in the United States knows the ABCs. And if I started singing A, B, C, D, E, F, G, you could sing. We all know it. We never forget it. So if I can choose a short melody for the child to remember and remember those coping skills, I can really help them get through some tough situations, either in school or at home, any kind of transitions. And on the other end, if I have a teen who's listening to songs and music that repeatedly are possibly kind of having them relive trauma because they're just trying to connect because that's their world, I can go into that world with them and kind of try to deconstruct and rewrite and help them find hope and healing in that without taking away their music, but kind of meeting them where they're at. So that's a short little example.
Yeah, no, that's a good example. I appreciate that. Members, any questions? Great. Thank you very much. We appreciate you sticking with us today and testifying.
Thank you very much.
Thank you.